I'm happy to be joined today by my former client, as well as friend Craig Richardville. Craig, it's great to have you with us today.
Ken is glad to be here.
And what I'd like to do is kind of start our conversation around some of the experience you had working with Profit Advisory Group. What financial impact did you see from working with our company, Profit Advisory Group, on your business?
Well, the best thing about your company is that the benefits that you provide go straight to the bottom line. And what I mean by that is you come in, you assume the risk because you're taking the investment of your time, of your team to come in, look at our external networking that we have in place, then making recommendations for us. Every dollar that we save goes straight to the bottom line with no expense to us. So it's a nice profit.
Awesome, awesome. Are there specific challenges that we've helped you overcome in the 3 different organizations we've worked on you with?
Yeah, probably a couple of them. One is the financial one that we talked about. We're always looking at how we can control our expenses, how we can make healthcare more affordable. Technology over time has become a larger and larger part of the spend in healthcare. So to be able to reduce that and add value back is certainly one piece. And the other one is more about collaboration, partnerships. In many cases, healthcare technology, we kind of grew up ourselves and we had to kind of educate and train ourselves on how to do the work. But then you have subject matter experts, such as yourself and your company, come in to help relieve us of some of that work, which means we're not in the telecom industry. We don't do that. We deliver healthcare. So the fact you're able to bring in that expertise allows us to be able to focus on the things that differentiate us from our competitors.
Awesome, awesome. And it's critical for the success of our engagements with our clients when we have support from senior leadership at a specific facility. And it's definitely been a struggle to get clients that are as bought in to having us come in and do it. We're here to help. We're here to partner. We're here not to point fingers or look for problems. We're here to fix problems. So that's always exciting to work with people who understand that concept. I mean, from our collaborations that we've worked on over the years, did you find some efficiencies and some new technologies that might have been beneficial to the patient or caregiver experience?
Yeah, the experience, if you go back and look at, the quadruple aim, which is improving the patient experience, improving the provider experience, having a higher quality outcome, as well as lowering expenses. You touch on a lot of those because basically by allowing us to be able to modernize our external network at a reduced cost increases the value. So that value proposition that you're delivering to the healthcare system goes to our providers, benefits our patients. You're bringing down the cost and allowing us to have a higher level of reliability with our networking.
Right. One of the things that we strive to do is we understand that your vendors are your vendors. We are here to help improve that partnership. And one of the things that we focused in on especially is those key vendors that you have, making sure that they become bought in as partners. They're not vendors, they're partners with your organization. And it helps improve pricing, service, quality. Can you kind of touch on that a little bit?
Yeah, that's a great point because when you look at historically, vendors have been part of our solution. And now, as we're looking to expand the services and to have a higher level of reliability with our services, the partnership becomes more important than the vendor. So to be able to have a shared risk, people coming in together, aligning with a common goal, and working together as a team and not as a threat really adds a lot of value in terms of acting as a single team as we try to move forward.
So in general, how do you measure success within your organizations that you've run over the years, Craig?
Yeah, when you look at success, there's so many different ways that you can measure it. But really, it does focus back on that quadruple aim. And everybody's success factors, in one way or another, come back to the patient experience first and foremost, as well as the quality of the service that we're providing, as well as making sure that we can make healthcare more affordable and also be a great place for our providers to practice. So when you look at all the different goals, they probably touch on one or more of those 4 and be able to move the industry forward And with partners such as you coming in, touching on many of those, that really allows us as a globally overall to be able to reach and exceed our goals.
Awesome, awesome. So in today's environment where technology is so critical now in the healthcare space, and we're trying to use more of the advanced technologies, the applications, AI, how do you work with partners to help achieve those more expensive, more cutting edge type goals while working with a company like ours or in any other partnerships you have to help be able to afford those nice to haves by moving forward?
Yeah, I like to kind of break it into two pieces. There's this foundational component, which is probably what a historical CIO used to be able to do. So you got your data center, your networking, your external connectivity, your applications. Those are all things that don't differentiate you from others. They're foundational. Everybody has to have them. And that's focusing a lot on the operational side of technology. Then there's the new stuff. There's the new stuff that is more innovative. So whether you're talking about using data, driving goals by using data, using the digital workforce that's out there and other digital experiences, as well as the advanced or artificial intelligence, those things will make you different. And you have a choice. You can either lead in those or you can follow in those spaces. So when you have partners such as yours that come in and help you with the foundational piece, that allows you then to be able to turn your focus over towards some of the differentiator things, the newer items that are coming up. And the best is yet to come, because the things that we don't know about, that's where we have to create the capacity to start focusing on.
Right. And speaking of the newer technologies, what things excite you the most about the future of IT or in technology in healthcare?
Yeah, it's really the power. It's really the transition of the power of the information that we do accumulate. When you look at the healthcare delivery side, we produce data, and then people make decisions on that data. We typically aren't making products or widgets or anything of that nature. We really are producing data, and that becomes our most valuable asset. And what we do with that data then becomes critical to our success. So taking that data and be able to move that into the patient's hands to allow him or her to be able to take control of their healthcare journey, and or to our providers, allowing them to be able to guide or make better decisions for the patients. So taking that data and putting it into use, to me, that's the future of how things are going. And if you look at the way that it has been in the past, most of the healthcare has been, you would go to a healthcare location. And now really healthcare is delivered in your pocket. It's where you are. So wherever you are at, as long as we have the data, we have certain guardrails to go around that to make sure people can't hurt themselves in making decisions, but allowing you to have choice and to make those decisions based upon the power of the data.
Awesome, awesome. Do you see any additional trends emerging in our space or in your space?
Yeah, well, you're seeing now, you have seen for the last several years, people who are starting to provide these services that are coming from, and you see it all across all industries, where it's not necessarily the bricks and mortar and then them converting into. You see new companies coming in now providing services, coming in from a data and a digital perspective right from the beginning. They don't have the bricks and mortars to rely back on. So you're looking at hospital at home and really kind of pushing the delivery of healthcare out to where the patients are.
Awesome, awesome. Well, one of the things that we've experienced with many of our clients is the limited resources that are available internally at the systems. And how do you see partnerships, whether it be with a company like Profit Advisory Group or other companies, can really help fill the need of those resources that are kind of dwindling a little bit on the organization side?
Yeah, they are hard to find. And when you have people like yourselves and other partners that are the subject matter experts, that then frees up your ability to start doing other things and be able to rely upon your partners. And so you really become part of that three-legged stool. You have ourselves, you have our partners, and you have our customers all together providing that stability. We can't do it ourselves. I can't be able to afford and educate to bring people in who have some of the expertise that our partners have. And the partners are then able to leverage that across multiple different customers of theirs or other different healthcare systems in our case, that allows us to be able to bring that in at a lower cost and a higher value.
Awesome, awesome. Well, another thing I would like to find out, Craig, you've been in the CIO position for years and years, many big organizations, big IDNs. What are some of the lessons that you've learned during that time?
Well, there's been a ton. If I had to kind of scoop them into three, I would say one is leadership is not a popularity contest. You have to sometimes make decisions that are not the most popular among some of the constituents. Two is you got to be a student for life. You got to continue to learn, especially in the technology field, the workforce and how that's changing. So you got to continue to stay on top of your game. And I would say third, leaders grow leaders. You have to be able to educate other leaders, bring them up. I like to say part of my job is to grow people's resumes, give them the ability to do more things than what they've been able to do, not to do the same thing for 5 years or 10 years, but keep challenging, allowing people that ability to grow.
Yeah, it is the exciting part about IT is it changes all the time. What advice would you give other organizations within the healthcare industry?
Probably the biggest one is to still have the ability to control what's happening in your environment, but to allow other partners to come into play. There's that piece that we talked about at the beginning about the operational side and the side then that is strategic. And we need to spend more of our time on the strategic side. And by doing that, that means you're going to have to relieve some of the hands-on side of the operations and trust partners to come in and to run parts of the organization for you. Hold them to certain service levels, objectives, but allow you to be able to use your creative thinking, your innovative thinking to move the industry forward.
Awesome, awesome. So what kind of strategies have you been using over the years to help improve that patient experience from a technology standpoint? I know we touched on a few, but are there any that we may have missed?
Well, I think the biggest thing still is focusing on what I would say is the health and wellness of the patient, allowing him or her to start developing those behaviors or those habits that allow them to stay healthier and more well in the future. There's so many other distractions out there, and we were talking earlier today just about how you are getting into health and fitness yourself. So it can happen at any point in your life, and I think it's important to be able to continue to show examples of how people can take control of their own health, of their own wellness, as well as be able to provide them the tools to take care of themselves at times when they're sick.
So Craig, how do you adapt to all the ever-changing market conditions within our industry?
This goes back to one of my mentors from years ago. He used to talk about what he called the 4Fs. And it was fast, fluid, flexible, and focused. So when you look at adaptability, in order to be flexible in an ever-changing environment, that's something that has to become a core competency of you and your team, because things will come in tomorrow morning that we didn't anticipate. You've got to be able to pivot appropriately and then move toward that challenge or opportunity.
Craig, thank you so much for your time today and for your partnership. It's been a pleasure working with you over the years at several different organizations, as well as developing a great relationship. At Profit Advisory Group, we focus on helping our clients reduce costs, improve technology, and improve innovation. If you'd like to hear any further information, please feel free to reach out. Thanks.